Did you ever wonder why a dog or cat suddenly starts behaving differently and nothing you do seems to help? Many people are told this means that the pet has a behavior problem. They are told that the animal is stubborn, anxious, defiant, badly trained, or even dominant. But very often, this is the wrong starting point. In this video, I want to explain an important point very clearly. Many physiological and psychological conditions can imitate behavior problems. And if you miss that connection, you can completely misunderstand what is happening in front of you. My name is Sagi Denenberg, and I'm a veterinary psychiatrist helping cats, dogs, and their owners. Behavior does not happen separately from the body. Behavior results from brain function, and the brain is part of the body. So, when something is physically wrong, the first sign may be a behavior change. That change can look emotional, or it can look psychiatric, or it may look like training issue. But it may actually be driven by pain, gastrointestinal discomfort, skin disease, or other physical problems. This is exactly why an assessment must come before treatment. If you rush to label the pet, you may miss the real problem. And once that happens, the whole case starts going in the wrong direction. Let me give you a few examples. Let's start with pain. Pain is one of the most common and most overlooked cause of behavior change in dogs and cats. A pet in pain may become less tolerant, more withdrawn, more reactive, or more aggressive. An owner may say he became grumpy, or she suddenly doesn't want to be touched, or he growls when we try and move him. And then very quickly people start talking about behavior. But often this is not the primary behavior cause. The animal is protecting itself. If standing up hurts, if the pet may hesitate, if being touched hurts, the pet may avoid contact. If being approached predicts discomfort, the pain may react sooner and harder. This is not stubbornness. This is not bad attitude. This is a physical problem being expressed through behavior. Now, let's look at gastrointestinal problems. This area is very underestimated. Chronic gastrointestinal discomfort can have a major effect on behavior. A dog or cat with nausea, abdominal discomfort, altered bowel function reflux, or ongoing intestinal inflammation may appear anxious, unsettled, restless, clingy, reactive, or unable to relax. Owners often describe these animals as nervous, but nervous may not be the right word. Uncomfortable be more accurate. When the gut is not functioning properly, the animal does not feel well, and when the animal does not feel well, behavior changes. That is not surprising. It's expected. Yet many of these pets are still treated as if the main problem is behavioral. People focus on training, they focus on routine, they focus on obedience. But if the animal is physically uncomfortable, those approaches may do very little, or they may make frustration worse. Now let's talk about skin conditions. This is another very important example. A dog with chronic itchiness, skin inflammation, allergies, recurrent irritation, or may show repetitive behavior such as licking, chewing, scratching, rubbing, pacing, or difficulty settling. And sometimes those behaviors can look very similar to compulsive disorders. This is where the mistake happens. People see repetitive behaviors and immediately assume the problem is psychological. But not every repetitive behavior is psychiatric. Sometimes the animal is responding to an ongoing physical sensation. The dog is not licking because it has compulsive disorder. The dog may be licking because the skin is inflamed and itchy. That distinction matters. It matters because if you treat the case as purely behavioral, you may miss the actual driver, and then the pet keeps suffering while everyone is trying to interpret or retrain the behavior that is still triggered by a physical condition. This is the larger point. Physiological and physical conditions can imitate behavior problems very convincingly. Pain can look like aggression, gastrointestinal disorders can look like anxiety, skin disease can look like compulsive behaviors. And if you do not assess properly, you can easily go down the wrong path. This is why I strongly disagree with the habit of treating behaviors as if it exists in a separate category from the rest of medicine. It does not. Behavioral problems are medical conditions too, but many physical conditions can present through behavior, and that overlap must be taken seriously. Now, let's deal with a few common misconceptions. First, my dog is just being stubborn. Usually, that is not a useful explanation. Stubborn is often a label. People who use that when they do not understand why the animal is behaving in that way. The second one is, it is just a training issue. Sometimes training is part of the solution, and some excellent trainers can help you. But it is a mistake to assume that training is a starting point in every case. Third, if the pet looks normal physically, then it must be behavioral. Also wrong. Many important physical conditions do not have obvious signs from the outside. A dog may be painful without screaming. A cat may have gastrointestinal discomfort without dramatic vomiting. A pet may have significant skin irritation even before the damage looks severe to the owner. The fourth misconception is, if I correct the behavior, the problem will go away. No. If the behavior is driven by pain, discomfort, nausea, or itchy skin, correcting the behavior does not address the underlying cause. It just adds more pressure to an already struggling animal, and that often makes things worse. Does this mean a physical condition causes every behavior problem? Of course not. But that is not the point. The point is that you cannot know what you're dealing with unless you assess properly. You cannot assume, you cannot jump straight onto label, you cannot skip the physical side and still expect to understand the case. That is why proper workup matters. That is why diagnosis matters. That is why behavior cases should always be assessed properly by a veterinarian first. If your dog or cat suddenly develops change in behavior or worsening behavior problems, or a problem that is not improving despite of training, stop and ask a better question. Not how do I stop this behavior, but why is this behavior happening? And part of the answer may be physiological. That is the message I want you to remember. A behavior problem may not be a primary behavior problem. It might be a visible expression of an underlying physical condition. And unless you recognize that, you risk misunderstanding the animal, delaying the right treatment, and prolonging suffering. So do not start with assumptions, start with assessment. Work with your veterinarian, and when the case is more complex, involve a veterinary behaviorist. That is how you give the animal the best chance of improving. If your dog or cat showing behavioral problems that are rapid, escalating, or do not respond to treatment, think physiological or physical conditions first. If you want more clear, practical, evidence-based medicine explanation, subscribe to this channel.